We have a new technology in that smartphones can now capture a lot of data that could be relevant to psychiatry. We've been able to capture this data for a long time with actigraphy, with customized sensors, devices that patients could wear on them. But what's changed in recent years is a lot of folks own smartphones from all walks of life. These smartphones can collect a lot of new data that we traditionally don't associate with psychiatric data. And the challenge now is, can we take all these new data streams and see if they're clinically useful and valid, and could perhaps give us a new lens to look at mental illnesses through. When you go see a mental health professional, be a therapist or a psychiatrist or psychologist, a lot of times some questions evolve around your symptoms. So how are you sleeping? How active are you? How social are you? And sometimes retrospective recall, especially when you're not feeling well, may not be accurate. If you ask me, John, how well were you sleeping 4 nights ago? I'd go, probably okay, I don't quite remember. That says potentially that my phone knows just by being a phone, because it knows when I last sent a message, it knows when it didn't move, it was off for a long time, and when my alarm went off, it knows I woke up. So you could begin to get some objective behavioral data, perhaps about sleep. You could collect voice data, and with voice data there's some evidence previously collected that changes in voice may be linked to depression. It could be potentially linked to schizophrenia. It could help us perhaps tell if a patient is depressed or becoming manic and bipolar disorder. And again, there's interesting studies that have already been done that showed all these are potential, but we haven't really said how would this work on devices that people are using in their own pocket when you try to scale it up. It also raises a lot of very interesting, perhaps frightening ethical issues that we have to consider as well too. Having these devices gives a window into our lives that are traditionally not part of the medical system. We don't associate our phones with medical data. And I think it's important that if we have this new tool and we can use it, we have to think, how are we using it? What's the responsible way to use it? And do folks that we're collecting on understand what's happening, where their data is going, who's looking at it, and do they have control over it? We did a study last year where we gave people a scale for depression called the PHQ-9, and it's 9 questions, and it can help tell about depression. And we did it in the clinic, and we kind of how we would do it today, and we also put it on people's smartphones, and they went out into the world for a month, and they reported their symptoms. And we compared how does simply self-reporting on your phone compare to when you come into the clinic and report. And we found, if you can imagine, you have 2 static data points at day 0 and 30, and that's what we do with clinical data right now. And if you monitor it every day, it can almost be like a roller coaster for some patients. There can be good days, there can be bad days. Symptoms may be reported higher. We found that people were reporting higher thoughts of suicide to the phone than they were in the clinic. That said, this was a very early study. We don't understand how valid that data is. Is it useful? What does it really mean? But I think it's an interesting glimpse into that we can capture, even with surveys on the phone, a lot of new information. And this isn't even looking at what we could do with phone data such as GPS or voice or Wi-Fi. So I think there's the potential, if we study this in a clinically responsible and ethical way, this could be a new lens and tool that we look at mental illnesses through. And I said it could give us some more objective measures of mental illness that allow us to kind of track data and say, here's how the disease is progressing, here's someone who's at risk for disease, here's someone who may be at risk for relapse. So we could perhaps intervene earlier. We could also perhaps have better diagnoses of mental illness, looking very far ahead, saying if we have all these new data streams, perhaps we can combine what we already know with these new data streams and begin to stratify, say maybe depression is not just depression, there's 8 subtypes of depression, or schizophrenia is not just schizophrenia, there's 7 subtypes, and maybe this new data will give us kind of the fine-grained comb to begin to separate out these illnesses. And once on the diagnostic side you can have better precision in diagnosis, you can begin to think that perhaps better treatments could match up to it. But I said we're still at the very early stages. I said we've had exciting sensors for years. We've never had them in the pockets of so many patients. And I said we haven't really even come to grips of what the data means, how useful it is, how valid it is, and then what are the ethical considerations? How do we educate the public that this data can be collected? in some cases, I think there's 165,000 health apps on the Apple and Android store. That's a lot of apps. That's more than we can ever regulate. There's no way we're going to tell everyone, this app does this app does this. So how do we educate the public to say, here's how I should think about when I download an app? I think when we offer people medication, even people looking at medication, they say, how could this help? How could this hurt? We're not quite thinking the same way about technology and apps yet, and it may be the next stage is for us to begin thinking of apps as things that have risks and have benefits. And same thing for any wearable technology or sensor. It could be a fitness tracker, it could be an app, it could be virtual reality goggles for the future. I think it's something that we should begin to know about now because our patients can directly access this stuff today. They can download those apps today. These apps are being marketed directly at them. And I think so if we know that folks are using them, I said we should at least be educating folks on them and how they work. That doesn't say psychiatrists, psychologists, therapists don't have to like it or even use it. But that said we should at least say, here's what it is so we can guide people and have informed discussions. So I think the future of this work is we're going to see some exciting research studies begin to actually gather a lot of this interesting data. And a lot of this work is going to be in methods. We can capture so much data, but how do we take this stream of what becomes ones and zeros from these electronic sensors and take that into actionable clinical information? So in Boston, we're working closely with the Onella Lab, and JP Onella is a researcher at the Harvard School of Public Health. And he's built a research app platform to begin to study this type of passive data, what the phone can collect. And it's a non-commercial app, it's a pure research platform. And I think he's doing numerous studies looking on what type of data can be collected, how the data works, and basically it's helping us develop new analytical methods and tools to make sense of it.